Good afternoon, and thank you to SAEM for the opportunity to present this educational abstract entitled Assessing Content Validity of a Faculty Procedural Skills Survey. My name is Brian Klein, and on behalf of the entire authorship team of Brown Emergency Medicine faculty, we have no financial disclosures to report. The focus of this research project was on the topic of faculty procedural skills competence. We know that faculty, like every emergency physician, must be competent to perform numerous procedures. And we know that based on experience and also the literature, that clinical practice alone may be insufficient to provide enough opportunity to maintain skills. There is no consensus on how to best maintain skills. And so in the interest of developing a procedural skills curriculum for our faculty, we initially conducted a needs assessment to determine faculty's experience with procedures. And so this is the first of two abstracts that descends from a faculty procedural skills survey that we developed. And one of the first steps we did was to assess the content validity of said survey. In addition, we sought to determine faculty experiences across a range of different procedures, and then ultimately identify their learning preferences as we devised a curriculum. So the methods for this project, the survey was developed through a very iterative process. We initially looked at the entire universe of adult emergency medicine and pediatric emergency medicine procedures, surveyed our faculty on their experiences and confidence level performing those procedures, and then asked for their learning preferences. One of the first steps in determining the content validity, which is really how well an instrument covers the relevant parts of a subject that it purports to measure, was the focus of this particular analysis. So we assessed the content validity of the survey. The survey itself, I can describe it. It had three major components. It asked for respondent information. So there were some demographics, board certification status, that is emergency medicine, pediatric emergency medicine, or other. Typically that was a combined EM or subspecialty training. Confidence with skills, and we broke them out by pediatric skills, common adult skills, such as central line or CPR, and then uncommon adult skills, which would be things like thoracentesis or cricothyroidotomy. And then the third part of the survey focused on the faculty development component. What were the attitudes and beliefs of faculty? What were their preferred methods of training? And what was the learning environment that they preferred? So the focus of the outcomes here were around determining whether this was a valid instrument. And so the way that we did that is we looked at confidence levels among pediatric EM trained faculty versus EM trained faculty for the different groupings. So for example, you would expect that pediatric EM faculty would have a higher degree of confidence than their adult EM counterparts when it came to pediatric EM skills. And so that's what we found, and it was statistically significant. Along those same lines, you would expect that for uncommon adult skills that our pediatric EM colleagues would have a lower confidence than our adult EM faculty. And that is in fact what we found, and it was a significant value. And then similarly for common adults procedural skills, the PZM faculty had a lower reported confidence than adult EM. So when the instrument behaves in this fashion, it suggests that with significant differences in confidence based on pediatric and EM status and by procedural frequency, that the instrument is behaving appropriately in terms of content validity. The faculty procedural skills survey also is useful, we think, for a broader application. And so the next steps in this project are to get multi-center input so we can generalize our outcomes.